Hi, my name is Brooke Edwards, and I will be covering the effects of stress on college students today. I decided to pick my topic because it is applicable to all college students. It is very important to develop healthy ways to manage stress. Being able to identify when your stress levels are elevated is extremely important, especially throughout your college career. I personally struggle with stress management, therefore, that is one of the leading factors of why I decided to choose my topic. Also, educating my fellow peers on the symptoms of stress and being able to cope properly to move forward is one of my main goals throughout my presentation today. What's the problem? Stress decreases sleep quality. According to the Anxiety and Depression Association of America, 70% of those who report persistent stress have trouble sleeping. To function adequately, we need at least 8 hours of sleep. Poor sleep makes stress management difficult to put into practice, as well as healthily impacting concentration, listening, and problem solving. Stress leads to friendships and relationships suffering due to the lack of motivation or time availability to put forth into maintaining the relationship. Losing those close friendships and relationships could be detrimental to someone's support system, which could lead to stress levels escalating heavily. The mental effects of stress can be more common but are significantly harder to identify. The psychological effects of stress include depression, anxiety, changes in behavior, i.e., becoming easily irritable, hostile, or angry. Possible preventions. Our bodies will indicate to us when we are about to shut down and that we need to take care of ourselves. Some of those symptoms include a racing heartbeat, skin problems, hair loss, rapid breathing, depression or sadness, upset stomach, constipation or diarrhea, trouble thinking clearly. The solutions: avoiding your stressors will ultimately make the symptoms worse. Learning healthy ways to cope with the stress will help strengthen your mental health, and the symptoms will over time become less intense or go away completely. Coping with the stress. A couple of examples are fueling your body with the proper nutrients it needs to be energized and handle the stress going on in your life. Finding an outlet to relieve stress. You don't necessarily need a gym to move your body. A couple of examples would be going out on a walk around campus or getting involved with yoga, any type of intramural sport, as well as going out into nature and allowing yourself to shut down those thoughts, take a step back, and enjoy the beauty of what's surrounding you. Next will be a TED Talk video explaining how to cope with stress and the effects physical and emotionally and mentally it has on a person's body.
Cramming for a test, trying to get more done than you have time to do. Stress is a feeling we all experience when we are challenged or overwhelmed. But more than just an emotion, stress is a hardwired physical response that travels throughout your entire body. In the short term, stress can be advantageous, but when activated too often or too long, your primitive fight or flight stress response not only changes your brain, but also damages many of the other organs and cells throughout your body. Your adrenal gland releases the stress hormones cortisol, epinephrine, also known as adrenaline, and norepinephrine. As these hormones travel through your bloodstream, they easily reach your blood vessels and heart. Adrenaline causes your heart to beat faster and raises your blood pressure, over time causing hypertension. Cortisol can also cause the endothelium, or inner lining of blood vessels, to not function normally. Scientists now know that this is an early step in triggering the process of atherosclerosis, or cholesterol plaque buildup in your arteries. Together, these changes increase your chances of a heart attack or stroke. When your brain senses stress, it activates your autonomic nervous system, Through this network of nerve connections, your big brain communicates stress to your enteric or intestinal nervous system. Besides causing butterflies in your stomach, this brain-gut connection can disturb the natural rhythmic contractions that move food through your gut, leading to irritable bowel syndrome, and can increase your gut's sensitivity to acid, making you more likely to feel heartburn. Via the gut's nervous system, stress can also change the composition and function of your gut bacteria, which may affect your digestive and overall health. Speaking of digestion, does chronic stress affect your waistline? Well, yes. Cortisol can increase your appetite. It tells your body to replenish your energy stores with energy-dense foods and carbs, causing you to crave comfort foods. High levels of cortisol can also cause you to put on those extra calories as visceral or deep belly fat. This type of fat doesn't just make it harder to button your pants. It is an organ that actively releases hormones and immune system chemicals called cytokines that can increase your risk of developing chronic diseases such as heart disease and insulin resistance. Meanwhile, stress hormones affect immune cells in a variety of ways. Initially, they help prepare to fight invaders and heal after injury, but chronic stress can dampen the function of some immune cells, make you more susceptible to infections, and slow the rate you heal. Want to live a long life? You may have to curb your chronic stress. That's because it has even been associated with shortened telomeres, the shoelace tip ends of chromosomes that measure a cell's age. Telomeres cap chromosomes to allow DNA to get copied every time a cell divides without damaging the cell's genetic code, and they shorten with each cell division. When telomeres become too short, a cell can no longer divide, and it dies. As if all that weren't enough, chronic stress has even more ways it can sabotage your health, including acne, hair loss, sexual dysfunction, headaches, muscle tension, difficulty concentrating, fatigue, and irritability. So, what does all this mean for you? Your life will always be filled with stressful situations, but what matters to your brain and entire body is how you respond to that stress. If you can view those situations as challenges you can control and master, rather than as threats that are insurmountable, you will perform better in the short run and stay healthy in the long run.
Next is a stress level test. It is a self-assessment. This test will help you measure if your stress levels are too high. The instructions are listed as below is a list of questions that relate to life experiences common among people who are experiencing significant amounts of stress. Please read each question carefully and indicate how often you experience the same or similar challenges in the past few months. Do you experience any of the following symptoms: headaches, chest pain, muscle tension, nausea, or changes in sex drive? Do you experience fatigue or struggle to fall or stay asleep? Do you worry excessively and feel overwhelmed with responsibilities? Do you struggle to focus on tasks or stay motivated? Do you experience irritability, sadness, or anger? Do you have little appetite or find that you are overeating? Do you struggle to regulate how much coffee, alcohol, or tobacco you use? Do you withdraw from others or feel overwhelmed in groups of people? Throughout those questions, I hope those can help you evaluate your stress levels and help narrow things down a little bit. And here are my resources that I used today for the project. I hope you all gained something from this presentation today, and thank you for listening.